Hey guys, welcome to Endo Warriors. I'm Callie Greenberg.
And I'm Jamie Silva. And this is where we have unfiltered conversations about endometriosis,
Women's health, and what it's actually like living with a chronic illness.
So grab your glass of wine
and let's get into it. All right, everyone, welcome back to another episode of Endo Warriors. I am joined today by Carleigh Turner, who is a fellow Endo Warrior, and Jamie Silva,
What's
my
up,
co-host.
Guys? Hey, guys.
So, Carleigh, first off, thank you so much. We've had such an overwhelming amount of applications from women that want to come on and tell their story, which is just a huge testament of proof that we have been so silenced and so dismissed that women really just want to come on and speak their truth and have their stories heard. So I always start each episode off with allowing the guests to introduce who they are and to start by telling as much or as little of your endo journey as you'd like to.
Yeah, absolutely. So I'm Carleigh Turner. I am in my 4th year of my PhD in pharmacology and physiology at Georgetown University. And I am also an endo warrior, as Callie mentioned. So basically, my story started my first period. Like, I think a lot of us. My mom is also an endo warrior. So I was kind of already aware of endometriosis. And so when I started having painful periods, my mom was like, let's go talk to the OBGYN. And I think I was probably 15. I'm 30. I'm turning 31 next week. But yeah, so basically I went to the OB and she was like, hey, sounds like you have endo. And especially since your mom has endo, let's just start you on birth control pills and like try to regulate that. So I've been on birth control ever since, different forms, but that's just kind of how it goes. Now, PhDs are notoriously difficult, and I will say that I was always kind of just managed by the birth control, I think, until the first year of my PhD, which was 2022. But I didn't know it was endo. And my main endo symptom, even to this day, is low back pain, but more so on my left side. I remember like just sitting, because you're in just lectures all day, especially the first year of your PhD. Sitting has always kind of been a not happy position for me. And so I was sitting in class and I just remember like my back just killing me. And so I would literally use the charging block from my laptop
For heat?
I would stick it behind my back, for heat, because I was so uncomfortable, and eventually to the point of tears. And then I started kind of tracking things and realized it was around my menstrual cycle that these kind of like flare-ups were happening. So I went to the OB, they did an ultrasound, they noticed a cyst on each ovary, but every ultrasound, and I've had now, I can't even count how many ultrasounds I've had. It was like, it's a hemorrhagic cyst. Oh no, it's an endometrioma. No, we think it's a hemorrhagic, So I didn't even really know what was going on.
So when they said that to you, did you know what they were talking about? Like when they said endometrioma or cysts, like did you have that language in your lexicon to be like, okay, I know what that is?
No. I had to like Google everything. This is something that I've become more and more passionate about. So like I said, I'm getting my PhD in pharmacology and physiology. So I might have a little bit of a higher standard of knowledge when it comes to things in the medical field, especially medications and drugs. But so much of this I had no idea, and I had to kind of figure it out on my own. So pain's getting worse, not getting better. I'm starting to really kind of feel like, okay, I'm thinking this is endo. So I'm like going to the OB's office like it's my job. Of course, I get the standard, take ibuprofen, 800 mgs, and then 1,000 mgs of Tylenol. And this is the frustrating thing about being a PhD student too in pharmacology. 'Cause, okay, endometriosis is a disease of inflammation, or like one of the things. So I'm like, an anti-inflammatory should work. Why is it not working?
Working.
Yes. Okay, I tried the birth control. That should work because we're trying to shut down my estrogen or at least decrease it or at least stop my periods. That doesn't work. Why is this not working? And
I'm gonna stop just real quick because I do want to.
please,
Sorry, I don't mean to cut you off. It's always so hard,
no,
obviously, because I have ADHD and I will cut you off a million times. So
please,
expect that to
yes,
happen for the next 45 minutes. But Jamie is a nurse, and
yes,
I want Jamie real quick to touch on
please.
what negative effects does taking that much
Yeah.
ibuprofen, Advil, Tylenol, what effect does that have on our body?
Yeah, so and that was always the thing whenever they like you said, they're telling you to take all these medications. And at what point is my body just either one going to stop responding to this? Because there has to be a point of where we just stop responding. Or at one point am I going to give myself a GI bleed? At what because you're nauseous, you don't feel good. You're not going to eat before you take 800 of ibuprofen or 1,000 milligrams of Tylenol. No, you're just going to take it and go lay down so you can try to get some relief. So, yeah, we're looking at GI bleeds. That could have a lot of people start saying that they have stomach discomfort and things. Well, hello, yeah, you're taking a ton of things that are super harsh on your stomach. But we also have to think about kidneys and liver. I mean, at what, like,
Exactly.
like, and then also we have the inflammatory disease of endo. How is that hurting on our organs? I had endo wrapped around my ureters and my kidneys. So I'm taking medications that are being filtered through my liver, my kidneys, all of that. But I'm also having an inflammatory disease attached to my organs. So, you have it like it's double whammy.
Yeah. And that's what I really wanted to touch on was because I think, and we can get into this, Carleigh, because I know this was really one of the main points that you wanted to talk to is
Yeah.
the treatment for endo and the lack of knowledge that we are given when told to take something and the side effects that that has. So we'll touch on that in a little, but please continue. I just wanted to touch on what these medications can do to other organs when we're taking them in the dosage that we're taking them and how frequently.
Yes. Just to double down on everything you guys are saying, and this is something that we had talked about a little prior to this call. When you are so desperate for pain relief, whatever the doctor tells you to do, you're gonna do. And so, especially for me, I'm like, well, this should work. So maybe I just need to take more, take it for longer. It's really a hard place to be as the patient, to be completely rational and methodical about what you're taking when you're like, I just want this to stop or get better or have at least a path
Mhm.
to feeling better. Yeah, very passionate about that topic. So they're doing these ultrasounds, they're seeing these cysts, and it's just becoming more and more clear to me that I need something else and other than birth control or Advil. And I'll never really forget. I'm sure all of us have had this crying on the doctor's office table experience. So I'm, just upset on the table with the paper over my legs. And I'm just like, I need help. This is not right. Something is wrong in my body. Every alarm is going off in my head that something is wrong. And then the OB looked at me, who was a woman, which kind of was shocking for me too, because I was like, empathy. But she
Mhm.
just goes, "What do you want me to do for you?" And then I was like, help me. Like I'm so lost. I don't know what to do. So I ended up going to a different OB and we talked through my options and surgery came up. And I was like, you know what? I think we're at a point where this needs to happen. And I've had 2 pelvic MRIs at this point that are showing adenomyosis as well as these cysts, but nothing else. So I'm not really thinking I have severe endometriosis, and I'm also kind of like, I'm still kind of gaslighting myself
Mhm.
Yeah, I
in
think
that.
that's like one of the hardest things as an endo patient is to turn that voice around in your head. Cause I mean, even up until I as I was going into the OR, I just kept saying to myself, what if they don't find anything?
Mhm.
What if everything that they just said on the MRI or saw on the MRI like weeks prior, what if like that was just artifact on the scan or, you know?
And then there's the fear too that
Absolutely.
if they do come back and they say, "Oh, we didn't find anything," there's still something going on. So then
Yeah.
you're left without an answer. Okay, well, now what?
Absolutely. It's so weird because you nobody wants to have endometriosis. But I think a lot of people who have the surgery where they don't find anything, which we know isn't necessarily always the case, right? It depends on the surgeon, but
Mhm.
they are almost jealous of people who get the
Yeah,
diagnosis because we at least have an answer
very
or
true.
a path to move forward. Whereas, people who are left with, sorry, didn't see it, then you have to go down other rabbit holes. And it can be really invalidating for those
Mhm.
patients. So I want to validate their experience
Absolutely.
also. So, yes, so we decide on surgery. And he ended up doing this blood test. And I do want to talk about this CA-125. They ended up because I had cysts that were complex, he was very reassuring that they don't think it's cancer because typically this is more of a blood test for cancer
Mhm.
markers.
Okay.
But he was like, but it can be elevated in endometriosis. So let's just do this blood test. So I did. My numbers were actually normal. So then, but that even added to my, okay, so do I not have endometriosis? I'm on Reddit. What do these numbers mean? Whatever. So I end up going to this first surgery, which was in April 2025, with a surgeon that I thought I had vetted pretty substantially. It said he was certified in minimally invasive gynecologic surgery, but not MIGS certified, which I now know is a red flag.
And let's just touch on that for a
Yes.
second, okay?
Yes.
Yes, I would love to capitalize on this because this is one of my pet peeves. Literally, I get frustrated because, well, one, there is no true fellowship or specialty for anything like this, for complex endometriosis cases, endometriomas, adenomyosis. It is truly managed by OBGYNs, which on one side, that's frustrating. But on the other side, too, we do throw a lot of things at them. If you think about every time you go to a doctor and it could be a women's health issue, you go directly to a GYN. So we do throw a lot at them, but I'm not dismissing the fact that they have a lot of work to do on endo. But there's no official fellowship, no official board certification, nothing that can kind of just put us in a straight path to say, this guy knows what he's doing. He will treat your endo, treat you full head to toe, and get your endo. We have the AAGL, which has minimally invasive gynecology, but there is no set standards for these advanced trainings. So they could go and do 12 months of these trainings, but they may never see an endo case. They may
Mhm.
just see more cancer or hysterectomies, all of these things. So there's such a huge gap. You might have a guy that says, yeah, I did a 2-year fellowship in, minimally invasive, but they might have not had the cases. The volume is huge. That was like one thing that I did start asking, how many cases have you done? And if they're like, oh, I do 1 a month, 2 a month, whatever. No, I want you to have 400 in a year at least minimum before I think that you could be trusted.
I mean, it's a true thing though, because I think Carleigh and I talked about this. And when she told me she thought she had really vetted and they said that they were a certified minimally invasive surgeon. Okay, for anybody listening, if
Mhm.
they say that on their bio and you think that that is great, no. Just like Jamie said, just because they are certified in minimally invasive surgery does not mean that they are a specialty in minimally invasive endo.
Surgeons are finding it's not just the pelvis. We have bowels, we have bladder, we have all of these major organs and arteries and veins. You can't be having someone in there that could possibly nick or cut or who knows what, because that can not only not give you the surgery that you need, but it could potentially really
Put you at
screw
more
your
harm.
life up.
Yeah.
Yeah.
Totally. So
Absolutely.
thank you for letting us interrupt you again.
Again.
No, it's good. That I was kind of hoping that would happen with both of your experience and expertise. I have my story, but you guys,
It's also like impossible to. One thing I've noticed is coming onto a podcast like this or hosting a podcast, it's impossible not to overtalk because it's not just me interviewing. This is really a conversational podcast. The cutting in and talking over is just naturally going to happen, which I
I
kind of
love it.
like about it, honestly.
I love it. No,
So,
as it should
yeah,
be a conversation, right?
absolutely.
So, yes. So I go to the surgeon, and at this point, I've had these 2 pelvic MRIs, however many ultrasounds, and he's all right. We can definitely do surgery. We can definitely take these cysts out. And, if there's endometriosis, we can get that as well. And he was like, just to let you know, if it's over stage 2, we will have to do another surgery on you. And I told other endo warriors this. I had connected with the endometriosis community in Washington, D.C., where I live. And they were like, which I should have listened to, but this is kind of going back to my other point. When you're so desperate, like I wasn't hearing anything. I'm having the effing surgery. I can't wait another month, to find another surgeon. How am I going to even find another surgeon? Like, I'm on the Nook page, Nancy's Nook page on Facebook, but I felt so lost. I'm in this town that I didn't grow up in, so I don't have like as deep connections as maybe someone else. So I'm just going to go through with it. And my CA-125 levels weren't elevated. The MRI isn't showing anything crazy. So it's probably mild, if anything. Could not be farther from the truth. But essentially, so I go in for the surgery. I go under. I wake up, and they had told me prior to the surgery, if I had 4 incisions, that meant that there was like extensive disease. Or they like did a lot of work, essentially. So I like look down my abdomen, I see 4 incisions, and I'm like, all right, they got it, Jamie's laughing because she knows where this is going.
When you first told me, I was like, wait for that beat to drop.
Yeah. Yeah. So I wake up and I am alert, and I look at the clock, and it had only been 1 hour. So there's the nurse kind of in my, recovery room post-op, and I'm like, "Did you get the cyst out?" And she goes, "No." And I was like, "Did you take anything?" And she said, "No." And I was like, "What the hell happened in there?" And so the surgeon comes down and sits on my bed, and he's like, "Hey, it was too extensive. It was stage 4 endometriosis. It was everywhere. And we're going to need to get a colorectal surgeon involved because it was all over my bowel," and just kind of left it at that. So I didn't know biopsies were taken. And honestly, going back to your point, Jamie, thank God, because everyone else who has heard the story is like, I'm so glad he didn't touch anything
Mm-hmm.
because he didn't know at all what he's doing. And he's one of the top docs of Washington, D.C., and then has all these, and he's still posting on Instagram, like, if you have endometriosis, come see me. And I'm just like, my God.
So I wanted you just made me think of something that I think is, I mean, it's not funny, but it's just the way the
No.
medical field works. Like whenever you go to your doctor and you're sitting on the table and you see this magazine on the wall that says top doctor,
That's
top
what it
25,
is.
whatever.
Yeah.
That's a paid thing.
Paid. Yeah.
Didn't know that.
They literally send my husband letters weekly that if you pay $500, $100, whatever, you
They
and
pay
your
to be in it.
practice can be in our magazine. And I'm like, wait, I thought this was voted on, maybe the county medical board, something. No, it's literally they just dark shoot
Paid
letters to.
advertisement.
Yep.
And they don't disclose that either.
No, they don't. No,
No.
because you literally see these magazines and you're impressive.
Right? Yep. And he has all these 5-star reviews on Google. So I'm just feeling, oh, this guy is the bee's knees. No. So now I'm set to recover from a surgery that is invasive,
Nothing
but wasn't
happened.
as invasive as, an actual excision surgery. But now I have 4 incisions that are going to become scars that from literally nothing. And then I'm back to square one because I know I'm not going to go back with this guy. So thank God in this PhD. So in a PhD, you have these people called principal investigators, and they're your mentors and your advisors, and they help you along this process. And so I have a co-mentorship between two faculty members, and they had known that I was struggling with some stuff, but I just told them I have back pain and I have a herniated disc because I didn't want, I was part of the problem essentially, not to be too hard on myself, but I didn't, I was afraid to tell them what was actually going on because I was, is this taboo? Is this weird? And the answer is no. This is a serious disease that
Mhm.
people have. So I just sent them a message and I said, hey, surgery did not go well, but this is why, this is what they found. This is essentially what I've been going through. I'm going to need to have another surgery. I just needed you guys to actually know what was going on.
Mhm.
And I was met with incredible support and validation, which was amazing. And actually, one of my supervisors, because I'm at Georgetown, we're connected to a hospital. And my advisor was like, if you're comfortable, we do work for an academic medical center. I have connections to the OB-GYN department. Would you feel comfortable if I asked around about, who the top people are at the hospital? And I was like, please, I need help.
Hmm.
I'm on grad student insurance, right? So how do I go through who's in network, blah, blah, blah.
Mhm.
But I knew that since it was connected to the university. And so got me set up with another surgeon. So in September 2025, so I had 2 surgeries in 1 year, which is just a lot mentally, and physically, but they were able to get everything out, and I'm finally feeling like I'm able to kind of start moving on that healing journey that started so long ago. But I finally also just felt validated, and after the surgery, my husband and my mom had the pictures and the operative report before I was even out of recovery. And she sat down with them and we took this out, we took this out, it was here, it was here. And so I just felt really supported. And especially because I'm in this kind of pseudo medical PhD, I'm always tell me everything, tell me what you did, what
Yeah.
does it mean? And she was extremely helpful with that. And yeah, so the only thing that wasn't taken was the endo on my diaphragm, which is a bummer, but they had no idea it was going to be there.
Mhm.
So it's been a wild
A
ride.
journey.
Yeah, but we're here. I'm still kind of, I'm still having some residual pain that I'm still kind of like working through, but I am just so glad about the communities that I've found because I feel, especially with endometriosis or really any kind of chronic illness, you need to find that community, find
Mhm.
your people, because that's who is going to get you where you need to be, or those good places that you can trust, because it can be almost impossible to navigate by yourself, you
Yeah.
know?
Yeah. And I find that it's a very isolating disease,
Yes.
period. It's so isolating. And it's not just yourself that's isolating, it's the medical community isolates you because you are so just, you're fine, you're normal. It's in your head. Let's put you on so many antidepressive medications that you're so numb that people actually think that there is something wrong with you because you're just staring into the sky most of the time. So, yes, you have to have that community where people actually understand. You might make plans in the morning and by the evening you
Yes.
want to cancel them.
Yes.
Carleigh, you and I talked about this on the intro call, is
Yeah.
we had a pretty deep conversation just in general about what tools we have right now in our toolbox in regards to managing endo. And we talked about how in one of your appointments, they were giving you options, but you pointed something out that was really important, which we had briefly touched on, is the lack of information we are given as patients on the side effects of these medications. So I wanted you to talk about that and your experience.
I was going through a significant pain flare up, and the only place I knew to go to was the OBGYN because I don't have a primary care physician here. I knew it was endo related, but I truly didn't know where to go. Like urgent care, they just do an x ray of my back and they're like, you're fine. So again, I'm just in tears. My husband's there. We're sitting in the waiting room and I see this drug rep come in. Do you guys need any more samples? And they're like, no, we're good. And then I sit down in the office and I don't know what to do. I feel I've tried everything. Is there any other med? But I don't want opiates. I'm not drug seeking, but I need something else. Is there anything else we can try? And they had already brought up these medications called Orlissa or Myfembree, which is this class of medication called GnRH antagonists, but they also have some estrogen added in to kind of try to mitigate some of these side effects. So another similar drug is like Lupron, which this
Everyone knows
podcast
my
has talked
feelings
about.
on Lupron. I
Yes,
don't need to say
yes.
it again because I think I mention it every episode.
Yeah. It's a lot. And so essentially, when you take hormonal birth controls, I actually have an IUD and I just started again the pill to try and stop because I was still ovulating with my progesterone IUD. But essentially, that is more kind of ovary focused. Whereas when you move to the GnRH antagonist, we're actually going to the brain and the hypothalamus. So you're shutting down that hormone that signals to the ovaries to release estrogen, right? And so the side effects can be pretty intense because you are putting your body in a medical menopause. It is reversible, but it is menopause. You're going to have very little, if any, circulating estrogen in your body. And so they had kind of been like, yeah, you can only take it for like a year. We would have to do a bone DEX scan, which is where they see the quality of your bones because you can become osteoporotic with this medication because estrogen is really essential for your bone density.
Yeah, basically, we're aging our bodies 50 years at the age of 20. Like, I mean,
Endo is an uncurable condition that you will have for the rest of your life. Pregnancy does not cure endo. We know this. You're going to put me on this medication that's only, if it gives you any relief, for a year?
You're talking about maybe relief, but what about all the symptoms that come when you are put into medicated menopause? As somebody who was put into surgical menopause, you still have all of those symptoms that you're dealing with because you were in menopause.
Yes. Yeah. And osteoporosis, that's not really going to get much better.
no,
Right?
it's not.
So
And
it's like,
I will add on to that.
please.
We just went through a thing with my mom having a lumpectomy, and now she's on letrozole, to get rid of any extra estrogen and all that. So she had her DEXA scan before, and she's following up. And they were like, you have minor osteopenia, and she's freaking out. Oh my gosh, what do I need to do? Da, da, da. So these drugs that they're wanting to put her on to help build your bones. I mean, have you ever read the side effect list? Could break your back, could break your hip, da 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 da. Could cause jaw necrosis. So we could potentially be causing 50 others because we're
Yes.
trying to fix the one problem you caused with this med. It's just never ending. It's the same way with birth control with young teenage girls. We're putting a 14-year-old on birth control, and then you're wondering why they're overweight, they're depressed, they're
Acne.
anxious, everything.
Yeah. Yeah.
Wasn't made for this. Medication was not made for this.
Or long
No.
time usage as long as we've been on it. I mean, I was on birth control since I was 14 and I didn't go off of it until I was 35.
Yeah. Yeah. And I'm terrified to go off hormones because I don't know.
Yeah. Well,
I
especially
don't
because you
know.
still have it on your diaphragm.
That true scares me because we know that endometriosis can and will come back. Just going off of the side effects conversation, something that I mentioned in the intro call that I'm extremely passionate about. Yes, we should trust doctors. I don't want to say that we shouldn't trust anybody in the medical community, even though most of us with endometriosis have been on the wrong side of the stick with the medical community. I don't want to trash talk the entire medical
There's
community.
some amazing doctors out there, but at the same time, there are some really awful doctors out there.
There are, and that's where that community comes in, where you lean on people who have had success and listen to them, learn from my mistakes, listen to them because they know. And a lot of the time they know because they've learned the hard way
Experience.
too, right?
Mhm.
Yeah. So when I was in this doctor's office and they literally hand me 6 bottles of my Fembry, the sample bottles. And they're like, just take this. This is going to help you. I put them in my backpack and then I dumped it in the trash when I got home because there is no way I am taking this medication. Aside from all the hair loss, weight gain, losing my bone density probably permanently. I'm on SSRIs. I have a huge propensity for depression. Have you read my chart? Are you kidding me? And so it scared me because yes, I am desperate. Yes, I'm in a significant amount of pain, but at least I'm able to know about this medication and I knew I had the choice to take it or not, right?
Mhm.
But I'm like, if someone else was in my shoes and this doctor is telling them this will fix you, what are you going to do? And so I just want to remind patients that, like, at the end of the day, just because you're prescribed something, you have every right to just say, okay, thank you very much. Get a second opinion, do your own, research, but not necessarily just chat GPT or, Google
Don't
AI.
just do Wikipedia and cheese.
Doing your own research can be good. It can give you some tools that when you go into the doctor's office, you can ask them, you know, educated questions, but definitely get second, third, fourth opinions and learn about the drug that they're prescribing you. And sometimes it can be scary because every drug is going to have a side effect. In pharmacology, one of the main sayings is all drugs are poison because it's true. All drugs are poison. It depends on the dose, route of administration, whatever. You can kill yourself from drinking too much water. As the patient, just because a doctor writes a prescription for you, it's not a binding contract for you to take that pill.
Mm-mm.
People you're coming on, and as somebody who has gone through it and experienced same thing, all three of us have a medical background in some sort of way, and
Yeah.
so we are very fortunate and not of the norm of people who go in and have that education to say, okay, that's great that you're recommending this, but I'm going to go through and do my own research before I agree to take it. So it is because of us sitting here having this conversation that we can inform those people who don't have medical backgrounds to say, don't take anything until you've done your own research or gotten a second opinion.
Mhm. Mhm.
You could be doing irreparable damage.
Yeah.
I love medications and I see the benefit and we need better drugs for endo. Like they just started a new research center, the Seekin Endometriosis Research Center, that I'm so thankful for and hopeful for, that we're going to get a lot better research coming out so that we can have better and more targeted treatments. But
Very barbaric at this point.
they suck.
They're
They
horrible.
suck.
Yeah.
We're gonna look at this time period of endometriosis treatment like we do lobotomies now for mental health treatment in the future. It's just so and it's such a horrible condition in that the gold standard treatment is invasive surgery.
It's positive that if they could, they would still give us endo patients lobotomies. I'm pretty
Mhm.
sure that's why many lobotomies were given back in the day.
Hysteria.
Mhm.
That's where
Yeah.
the word comes from, right? Uterus, hysteria. It's so unfortunate. As unfortunate and grim as things are, there is hope and there are options. And I did kind of want to like touch on those also
Please.
but there are options. So I was really excited when I learned about this thing called the hypogastric nerve block. And again,
Have you heard of that,
I haven't.
James? Talk
lots.
Explain
about
it.
it. Yeah, talk about it.
Love. So I've had this procedure in May and I'm going to get another one in April to deal with some lingering symptoms that I'm having. So there's a nerve called the superior hypogastric nerve or iliohypogastric nerve, and it innervates essentially all of your pelvic organs.
Okay.
And so they can do a sympathetic block of that nerve. And it's not only has diagnostic capabilities. So let's say you get this nerve block and you experience relief. It's like, okay, the pain that I'm experiencing it is coming from these pelvic organs, and it's not permanent, but it is a tool, right?
What doctor did you go to for this? Was it spinal or?
Yes. Yes. So a pain specialist. So they're typically anesthetists, but they have experience with spinal pain. And so this is something that I had to ask for. It was not necessarily offered to me, but I had kind of heard about it in my research, my self
Mhm.
research. And I was like, I think this could help because going back to the first thing we talked about, I don't want to be taking Advil every day. I
Mhm.
know it's horrible for you. And I've been on, gosh, meloxicam, ketorolac, diclofenac, every NSAID that can be prescribed, I've been prescribed, right? So we gotta
Yeah,
try something else.
you want the pain to go away, but you still want to function. When I was 16 years old, I was handed a Vicodin prescription. Yeah. I
Oof.
mean, yeah, my pain is bad, but not enough where I need to like knock myself out so I'm not
No,
feeling anything. Like
exactly.
I can
Yeah,
I can tolerate it. I want to feel normal and be able to tolerate it. I don't want to be drugged. So, no, I
no.
totally get that. Do you know what meds that they use whenever they did your
Believe so they use lidocaine for
Mhm.
sure. And then they corticosteroid just for the inflammation, but I'm pretty sure the block there's bupivacaine. Oh, there we go. I know they gave me fentanyl and Versed for the block, which was lovely. As far as what they inject, so it is lidocaine and a steroid, but then what they can do is they can permanently destroy the nerve using like ethanol or alcohol.
Mhm.
I'm not there yet, but it is an option that, again, like I had to ask for. So your doctor may not even know about it. But if you, there are typically it's more of an anesthesiologist, pain specialist that can do these. And I was able to fly to Norway, which was like over 24 hours of flying. I get anxious about 1 hour flights because my
Mhm.
back, especially, and it was going to line up with my cycle too. I was going to present my research at a conference in Norway. I can't let this condition, endometriosis, prevent me from having this life changing experience. So I ended up getting this nerve block before I left. I have this video on my TikTok. I have no pain, none. And I just flew for 24 hours. What? So, and it's a very nice, even though it's not permanent, it can give you answers diagnostically because of the nerves that they're targeting, but then also the relief aspect. And then also, it's not a daily med that
Yeah, we're
you're
getting
taking,
off of
right?
the internal systemic medications that we're ingesting on a daily basis. Yeah, I
Hmm.
love this.
Exactly.
Isn't that
Yeah.
cool?
I
Yeah.
love it.
So there's that. There are trigger points. So we know with endometriosis, hypertonic pelvic floor, a lot of the times when people have pain post surgery, it's due to this constant muscle guarding that we experience because we're in constant pain. And
Mhm.
just excising those lesions is not going to fix that, which is why everyone is going to recommend pelvic floor PT post treatment, right? There are places that can do trigger point muscle like injections to get those muscles to relax. That can be extremely helpful. Haven't done it, but I've heard amazing things. Also, Botox. People can get Botox in their pelvic floor.
Mhm.
So Botox is going to paralyze those muscles so they can relax.
I do want to add that with the Botox, make sure whoever is injecting Botox that they are certified, qualified, know what they're doing, because in that pelvic area, you have your bladder and you have bowels. You could potentially control of both of those. I mean, it was recommended to me. I said absolutely not, especially not by just a GYN. I'm pretty sure there are actual certified people that do the Botox, just because, I mean, you're stuck with it for possibly 3+ months. I did do the injections, the pelvic floor injections with lidocaine. After the first couple ones, it's mainly lidocaine and just saline, but they did steroids before surgery to kind of help chill everything out. And I did notice a big difference.
The field needs to start thinking a little outside the box, right?
And can we stop with hydroxychloroquine for
Yes,
everything?
please.
I can't.
There's a guy in one of the advocacy groups, and that's his research, and they're doing it on
For
rats.
endo?
And they're doing it on rats. And
I've not heard of that. Oh my God.
Oh my God.
No. I was going to talk about too. I do not react well to THC. I have no qualms with anybody using that. I've heard I wish it worked.
There's a lot
There's
a lot of research on cannabis, and I actually had a great
Yes.
guest on who talked about it. So if you
I
haven't
saw.
listened to that episode, it's so informative, and oh my God, Melanie is
Yes.
so smart.
well, Callie, you live in Colorado, so
Trust me, I dip in some cannabis, you guys.
Yes.
Hell yes.
But it can really help. And she talked about the brain and how it helps your brain interprets the sensation, right? It's really good at doing that. And I love CBD suppositories.
girl,
Totally agree.
lived off suppositories. When people ask me about suppositories and whether they should be rectal or vaginal, it's so vascular. It absorbs it so quick into your bloodstream, and it works.
It's from the pharmacology standpoint, right? So when you take a pill, it has to be processed. We talked about by your liver, by your kidneys, got to filter it out through your urine. And then it's going to get to your body.
Like, how much of that are we actually absorbing then for it to help with what we're taking it for?
Exactly. To do the vaginal suppository, I am putting the medication where it needs to go. Exactly where it needs to go. It doesn't have to go through anything else. I don't even know if there's as much of a stigma around it anymore, but look into those. And there's gabapentin and baclofen suppositories also that are, so you have the muscle relaxant and
did those.
Woohoo.
I had Valium, baclofen, and gabapentin. I didn't even hesitate. And
No.
Whenever I was younger, I'd be like, no thanks.
You're like,
nothing is going up there. But now I will
take
anything.
I will do whatever you want me to do at this point.
I just want to say this one thing that I feel like isn't talked about appropriately, which is this thing called central sensitization.
I was just going to ask you about that.
Your pain is not in your head. No, I'm, and when I talk about this, I need that to be extremely clear. A thing that can happen when your body is in a state of chronic pain, which with an endometriosis, we got that going for us, nerves can become hypersensitized to react to painful stimuli. I'm going to use the term stimulus. So a slight touch on the finger, if someone has increased sensitization in that finger, is going to send a stronger pain signal to the brain. That does not mean you're weak. That does not mean that you aren't strong enough to fight through anything. No, it's just how the body reacts to chronic pain over time. And so doctors may bring up this thing called central sensitization, which is that kind of hypersensitivity of these nerves. And so that's what I mean where they talk about inappropriately, where they bring it up, well, you're just overreacting to the pain, or your brain is more sensitive to pain. Well, not really. It's really not just you're have a low pain tolerance, right? but the nerves that react specifically to painful stimuli are so hypersensitized that any sort of trigger to them is going to shoot that signal to your brain. I'm in agony. I am in pain. So I just wanted to bring up that point
No,
because, yeah,
I love that point because I am getting a lot better, but whenever I used to have my cycles, just someone touching my shoulder, it hurts so bad. Sometimes even just in clothes, these clothes have to
Yeah.
come off.
yeah,
And I had mentioned that to one of my primary care physicians. Oh God, don't tell me that you think you have fibromyalgia. And I was like, no, I mean, I'm literally just telling you what I feel. That's your job to possibly come up with some differential diagnosis. Like, that's not my job. I'm paying you to be here. But then I started thinking, do a lot of these people with fibromyalgia have endo?
Mm.
Have you ever heard of a man having fibromyalgia? I don't really think I've ever really met a man with fibromyalgia. I'm just wondering. We've talked about before, is the chicken or the egg type of thing.
yeah,
Is it the endo causing these women to have such sensitization? Endo's totally missed, but now they're being diagnosed with fibromyalgia because in the medical community, that fibromyalgia is one of those things that's thrown at somebody whenever they can't figure out
exactly.
what they have going
Yeah,
on.
yep. That's how I was told. I have IBS for 20 years.
Yes.
And yes, irritable bowel syndrome is horrible. It is a thing, but it is thrown out when when you explain symptoms and doctors also just don't know what's going on with
Irritable,
you.
Yeah.
irritable bowel. Well, what is irritating my bowel?
The hundreds of endometriosis lesions on it, and
It
then
could be dairy, it could be sugar. Why don't we do a FODMAP diet and do an
yeah.
elimination diet? And it's like,
So I got out of my surgery. I had a 2 centimeter and a 3 centimeter nodule hugging my rectum. And I didn't even know how painful going to the bathroom was until that was out. And like, my first thought after surgery, oh my God, it just comes out. Like the poop just comes out. I don't have to feel like I'm literally pushing out organs to go to the bathroom. I would tell people I have to kind of strain to use the bathroom. My stomach hurts or whatever. Go from having unable to pass stool to passing stool a little too easily.
Mhm.
Oh, you have IBS. I had an ultrasound tech. She couldn't even see my organs.
because you were so full of shit.
Because- Yeah, literally. She goes, "Do you have IBS?" No, I had freaking tumors, endo tumors, essentially, blocking stuff from coming out. It's too easy to just tell me that I have IBS and then you said low FODMAP diet or watch your sugar. And I remember asking a doctor about diet. I know there's some good evidence for gluten-free, but again, when you have literal tumors of a pro-inflammatory tissue that creates its own estrogen, creates its own nervous tissue, eliminating gluten is not going to stop that. It can't. When I asked this doctor, she was like, "Well, you're asking me essentially if you should eat healthy. I'm not going to tell you to not eat healthy. It can't hurt to have more vegetables and fruit." But I think there can be some misleading voices out there that are, I cured my endo with this diet. And like,
Do not
I know.
follow or take any of those people's advice or suggestion, and I don't care.
No.
People can clap back at me as much as they fucking want, but if you are telling the public and you are using a platform to tell
Yeah.
people that you cured your endo by changing the way that you eat, you are the biggest fucking fraud and actually should
I
be
know.
sued.
Yeah.
Yes, thank you. The huge trend now is matcha.
Yeah.
And I
I
see
was
all of
told,
these girls chugging matcha. And okay, yes, it does have great properties to it to help with inflammation and all that.
yeah.
But it also can delay absorption of essential vitamins like B vitamins, iron, all of that. If you're eating and drinking at the same time, you're not getting the nutrients from that food that you really, really need that are very important whenever you have endo, like iron because you're bleeding a lot,
Yeah.
B vitamins
Magnesium.
because you're fatigued as hell all the time.
No,
So
that really, really pisses me off, and
Yeah.
guarantee you I will get haters, and come at me, bro. Come
It
at
has to be
me.
said, though. It has to be said. I'm seeing a functional nutritionist who has put me on some supplements. And again, I love science. That's why I've dedicated my life to it. She has said to me, I know this will not cure what you have, but we're just trying to
It can
supplement.
help. It's a tool. It is a
It's
tool
a
that can help,
tool.
but it
It's
is
a tool.
never going to cure cancer. It's never going
No.
to cure
no.
endo.
And I always tell people it is a great thing to use along with modern medicine.
That's right.
Never make it your full
No.
thing. You have because there's not enough. I mean, I say this, there's not enough research behind some of these things that they do, but also here we are. Endo doesn't really have that much research
No.
either. So here we are taking medications and was this actually really researched on endo? I don't think we even know.
No, but
You
we
know?
know
No.
that there is not a cure. So
There's
anybody who
not.
is out there and saying, I fixed my flare ups or I solved and found the answer to endo and it's really not X, it's Z. Nope, I'm sorry. At least we have enough research out there for you to go yourself and research and find out that there is no cure. You can help
Exactly.
manage. And also, everybody's endo is different and how your system responds to things is going to be different. So maybe a low FODMAP diet does help one person. It didn't help me.
No. No.
I literally
Yeah.
tried to up my greens and it made
It worse.
worse.
Yes.
I
Yes.
was dying.
Yeah.
I did Whole30 in January and I had to stop 2 weeks in because I had one of the worst flare-ups
Yeah.
of my life. And if it helps you, people always talk about this placebo effect, right? And we love a placebo effect. If holding an amethyst crystal to your forehead takes away your cramps and you don't have to take 800 milligrams of Advil 4 times a day and destroy your liver and your kidneys,
Implant
then
that crystal in my head.
Yeah.
do it. I support that 1,000,000%.
If it works for you, great. Amazing.
Yes.
Sell
and
it as a cure-all for everyone. That's my thing.
Exactly.
I mean, it's probably my heating pad that I still curl up with
Yeah.
several months after surgery. I just can't part with you
No,
yet.
fine. I'm not coming at you for wanting to eat healthy or changing or trying to fix or try different things and managing your endo.
Yeah.
But for people out there who are selling it as
No.
a cure, fuck you.
Yeah. Because you give people hope, right? And I want to give people legitimate hope, which is talking about these things like the nerve block and these suppositories that aren't on the doctor's first item to go down, but you bring that stuff up when you meet with your doc. It's the people that get on social media and I cured my endo by eating these different shakes and you
No.
can too. Again, you're desperate and you're, like,
And they're
I'll
like,
try
try this
it.
protein powder. And you look up the ingredients. This is garbage.
It's
Awful.
garbage.
It's from
Garbage.
China and has everything synthetic and processed and
Yeah.
disgusting. On that note, I'm going to wrap it up. Carleigh, how much we appreciate your vulnerability and your dedication to wanting to help this community and sharing your knowledge. Always like to play a little rapid fire game before we close the episode. Hopefully you're okay with playing a little game.
I love it.
Okay. So, what was your favorite childhood game?
Oh my gosh. We used to play Ghost in the Graveyard, Kick
Yeah,
the
yeah, yeah.
Can. Yeah, yeah.
Love that
Miss
one.
those days.
That's so
Yeah.
funny.
Yeah.
All right. If you could speak any language with a snap of your fingers, which one would you choose?
Honestly, Spanish. I wish I was better
mean,
at Spanish.
I wish I could speak English.
Yeah.
Make me actually speak language that I was born to speak and not have dyslexia and say things backwards. Yeah, I wish I could speak Spanish too.
Yeah.
Okay. If you could pick a superpower, what would it be?
Flying, 1,000%. I had
What
a
would yours
whole
be,
Peter
Jamie?
Pan thing.
What'd you say?
What would yours be?
Me? Time travel.
For me too.
I mean, just a week, just so I could like see what my week was going to look like so I could prepare.
That, or do I want to know what other people are thinking? I don't know.
But then that might cause an anger issue
Yeah.
in me because it might really piss me
Yeah,
off.
I agree. I don't really care what you're thinking most of the time. So, no, I'm kidding.
I'm still not going to stop what I'm saying.
I come off as such a bitch. I'm like, I don't give a fuck about you. Okay. And always end with, if you could go and give one piece of advice to your younger self, what would it be?
Listen to your body and don't stop until you get someone who also listens to it too, you know?
Love
Yeah.
that.
You know
Yeah.
your body best. Absolutely. I love it.
Yep.
Yeah.
Well, thank you again for coming on and just being here and talking with us about some really important topics that have to do with endo. And we wish you the best with your journey. Please stay in touch. And if people
Yes.
want to find you on social media, do you have a handle that you can share?
Yeah, I talk a lot about my endo journey and mental health journey and meds and all that stuff at brain.nerd on TikTok. See you there.
All right, everybody. Thank you so much for being here. And we will see you next week for an all new episode. Bye.
Bye.
Thanks so much for listening to this episode of Endo Warriors. Don't forget to hit follow, subscribe, and leave a review so other warriors can find us. Tune in next time for an all new episode.